Welcome to my podcast. Today I'm going to talk about another case station, which is a needle stick. So basically, there are two case stations in regard. The first is about a needle stick injury for a nurse at the workplace, and another one is the needle stick for a kid when he's been escorted by his nanny or a relative. So you will start off after introducing yourself and checking the patient name and date of birth. You ask how this happened, whereabout, tell me more. What sort of injury is it? Is it a superficial or deep? What was the needle for? What you were doing at the time. So for instance, in the nurse case, she might say, I was taking a blood, and then I poke myself, and you will ask if the nurse had washed her hand with soap and water and let the blood come out from the injury area. And you will ask if she had notified the occupational health, and you need to fill incident form as well, and she need to inform fill incident form and inform her senior. Also, you will arrange for blood to be taken and for viral screen and to be repeated within 2 and 6 months, and also ask about her vaccination status. Say, for instance, hepatitis B. So if she had taken the 3 previous doses, she might need to take a booster. And also you will ask her that she doesn't need to donate any blood, and she should have a safe sex. And also, if she's distressed or worried too much, you just need to ask her to take a day off. Because it's traumatic basically experience, and also ask about any risk factor, like for instance tattooing, because that's involve a needle to put the dye inside the skin, and what sort of needle is used, and also if there is history of drug intake and what means it's used for to deliver that. And also ask her, she might need, because after blood being taken for viral screen, we might arrange for post-exposure prophylaxis. And also if the patient will known, for instance, with any of the infectious disease, she will definitely need to take post-exposure prophylaxis. So if it's in the medical setting, she can check that and know if the patient has any of that. So that's basically for the nurse thing. Apart for the kid, so it's basically you will ask when the incident happened, whereabout, what sort of injury, if it's a needle or a stick. You will ask if it was rusted or dirty, and you will look. Also, you will ask if she had washed the place with the soap and water, and if she informed the child parent about the incident. Also, you will inquire about if the child is up to date with their job, and also if he had took toxoid tetanus, because that's basically involved 5 doses. So you need to check. It's in second, third, fourth month, and preschool and post-school according to the age of the child, of course. Also, you will ask how she had managed it so far, and if there is any medical condition that you should be aware of. Any medication, and if the child is his milestone is developed as it should be expected. And also you'll check the book if there is anything doesn't seem right. And yeah, from that you will just take it. So that's basically whenever there's any accidental needle stick injury, that's the main thing that you need to inquire about. And of course, don't forget about family history, if there's anything that you should be aware of, any allergy, any medication in both cases. And also in the nurse case, you need to ask about risk factor, which is very important, as I mentioned, like unprotected sex and drugs intake, if it's involved needles or sharing one, and the tattoos as well. And you'll ask the patient if they have any specific concern or worrying, and ask why would she had that and what's her thoughts, and you will agree about the management plan as been stated, and yeah, we will take it from there. So that's basically the two cases in one, because it's involving needle stick injury. Thank you.